our next panel, as we're changing the table, the next panel is the Public Transit Association, Niagara Transit, the Christian Labour Association of Canada, and the Niagara Health Coalition. And as they're coming to the table, the directions will be the same. You will have 7 minutes to make your presentation. At 6 minutes, I will say 1 minute. At 7 minutes, I will say thank you and move on to the next item. And we do ask you, as you start your presentation, to make sure that you give us your name to make sure that we can attribute the comments to the right person. So with that, the first presentation will be the Ontario Public Transit Association, Niagara Transit. I believe it's the mayor. Well, welcome, Your Worship.
So much. My name is Mayor Matt Cisco. I'm the mayor of the city of St. Catharines. I'm also chair of the Niagara Transit Commission. And I'm proud to have the opportunity to present to you today, representing the Transit Commission that connects our growing community here in St. Catharines and across the Niagara region. I'm also representing the Ontario Public Transit Association, of which NTC is a member. Public transit isn't just about moving people, it's about building stronger communities. And in St. Catharines and across Niagara region, transit is our key connector. It helps residents access education, employment, healthcare, and recreational opportunities. And it fosters social inclusion, ensuring that all residents, regardless of income or ability, have access to the opportunities they need to thrive. Every dollar invested in public transit generates returns that ripple through the economy and society. And as we look forward towards the Ontario government's upcoming budget, I'm here to highlight the challenges transit agencies like the NTC face and to share recommendations for sustainable funding that will help us meet the needs of our growing population. Like many transit agencies across Ontario, the NTC is facing a perfect storm of challenges, even as ridership has grown beyond pre-COVID levels. Operating costs are rising steadily, maintenance, fuel, and wages, yet funding has not kept pace. The Dedicated Public Transit Fund, or DPTF, which relies on a 2-cent per litre gas tax, provides predictable, flexible funding to transit agencies that can be used for capital and operating expenses. It has been used by transit agencies to do exactly what it was intended to do, grow ridership. Yet it remains at 2019 levels. Moreover, the fund has not kept pace with inflation since it was introduced in 2007. Over this period, its purchasing power has dropped by 30%. 2 cents in 2007 has the purchasing power of 1.4 cents in 2024. Adding to the pressure, Ontario's population has grown by nearly 1 million people over the last 2 years. Here in the Niagara region, we've seen our population increase from just over 450,000 in 2016 to over 525,000 currently, and we're projecting that to increase to just under 700,000 by 2041. As ridership increases, the funding needed to maintain and grow service must as well. Without intervention, these financial constraints force difficult choices, including cutting service frequency and coverage, which will reduce access to critical destinations for residents, foregoing service expansion on new routes at more times of the day, hiking fares, which places an undue burden on those who rely on transit the most, and drawing from municipal reserves, which puts our municipalities at risk. When transit is underfunded, agencies delay necessary fleet maintenance and replacement, and that inability to replace aging buses leads to rising maintenance costs and reliability issues, which further erode rider confidence. This is why the NTC and the Ontario Public Transit Association are recommending a top-up to the DPTF, raising its funding to $725 million for the 2024-25 fiscal year. This adjustment reflects not only inflation, but also Ontario's population growth. It would restore the fund's original purpose, supporting ridership growth and ensuring that transit agencies can meet the needs of their communities. For the NTC, enhanced DPTF funding would allow us to maintain existing service levels to keep our riders connected and invest in replacing aging buses, which would reduce the financial strain caused by the increased maintenance. Niagara Transit is completing our first master plan in 2025. This includes revised routes and schedules, future planning routes, and investments in new vehicles, including zero-emission buses. It is the first fully regional transit plan in Niagara Region's history. It will be critical for creating a truly interconnected region and making important connections to other transit systems such as the GO network. Niagara Transit's transition from an assortment of separate transit systems to a proper regional service has not been easily accomplished. Municipal budgets are constrained, and transition costs have been a significant burden on the system. Verbal commitments to transition funding were made from higher levels of government prior to amalgamation but did not materialize, leaving Niagara Transit with no reserve funds for both vehicle and building infrastructure that is badly in need of replacement or repair. Investment by the provincial government will contribute significantly to the realization of the upcoming master plan, helping to jumpstart transit improvements needed for our growing population and to realize exciting projects like the province's vision for Vegas North in Niagara. This isn't just about maintaining transit. It's about building a foundation for economic and social mobility, particularly as we recover from the challenges of the last several years. Alongside operational funding, the NTC faces significant challenges with capital investments. Procurement costs for new buses continue to rise, and delivery times have been delayed as the North American manufacturing market contracts. On average, our buses are older than they should be, which increases maintenance costs and reduces service reliability. The average bus age in Ontario has increased from 8.3 years in 2019 to 9.5 years in 2023, underscoring the need for sustainable investments. The NTC also supports OPTA's recommendation that the province match the federal funding in the baseline stream of the recently announced Canada Public Transit Fund, an estimated $220 million annually in Ontario. There's precedent for the province matching federal transit funding. Federal programs like PTIF and ISIP have already demonstrated the power of collaboration, with $17 billion invested in Ontario Transit between 2016 and 2023. Niagara Transit is expecting to receive roughly $3.5 million annually, or $35 million in the 10 years of the Canada Public Transit Fund. Provincial matching will allow us to do more for our residents and reallocate municipal funding towards operations. By continuing this model of partnership, we can ensure that our capital investments, whether it's fleet renewal, infrastructure upgrades, technology investments, or state of good repair projects, are both sustainable and effective. These investments are critical to the long-term viability of transit systems, including the NTC, and to meeting the growing needs of our communities. With respect to rural transit investments, we commend the government for establishing the Ontario Transit Investment Fund as a successor to the Community Transportation Grant Program. This new initiative reflects the government's commitment to addressing the mobility needs of Ontarians, particularly in rural and remote communities where access to alternative transportation options is limited. As we approach the Ontario budget, I urge the government to prioritize sustainable public transit funding. Enhanced, dedicated public transit funding and provincial matching of federal transit contributions will address the critical operational and capital funding gaps that we face. Continuity between the CTGP and the new OTIF will signal strong support for rural communities. The Niagara Transit Commission and the Ontario Public Transit Association are ready to be part of the solution. We stand ready to work with the provincial government, our municipal partners, and other stakeholders to ensure that public transit continues to serve as a foundation for economic growth, environmental sustainability, and social cohesion. Thank you for your time, and thank you for your commitment to public transit.
Thank you very much for your presentation. We now will hear from the Christian Labour Association of Canada.
Chair and members of the committee, thank you for the chance to come address you today. My name is Ian DeWard. I'm the Ontario Director for the CLAC, or CLAC. We're an independent trade union whose 19,000 Ontario members work in a variety of sectors, including healthcare, construction, and emergency services. There's much to applaud about the government's ongoing commitment to work for workers, but there remains much to be done. From our larger budget submission, my remarks today will focus on a few key areas, initiatives that we think will directly impact some of Ontario's most essential workers. We strongly recommend that with this budget, the government extend WSIB coverage to retirement home and residential care workers. Every day, these workers put their health and well-being at risk to care for our most vulnerable citizens. They experience injury rates and occupational disease at levels equivalent to their counterparts in hospitals and long-term care facilities. While WSIB coverage is mandatory for the latter group, retirement and residential care workers are not protected by the public workplace insurer. Instead, they suffer inferior private insurance that prioritizes employer liability over proper care for the injured or ill worker. The WSIB's 2020 operational review that was commissioned by this government identified this as an unjustified anomaly that requires immediate action. And in our view, it is well past time to take that action. Our next set of recommendations has to do with home care workers. These workers are in an even more fragile situation, making $6 an hour less than their long-term care counterparts. They travel from client to client, mostly using their personal vehicles. Mileage rates are inconsistent, but as low as 38 cents a kilometer, barely half of what's allowable by the CRA. As well, the time spent traveling between clients is often unpaid or paid using a formula that amounts to less than minimum wage. It's no wonder there's a massive worker shortage in this sector, and in our view, that will not be solved by recruitment initiatives alone. These problems, we think, are attributable to two fundamental flaws in the system. Firstly, home care contracts are awarded on a bid tender approach, which invariably drives providers to compete for the work, in large part on price. Inevitably, employees bear the brunt of these organizations' reasonable search for cost efficiency. We recommend that the procurement process for home care service providers be reformed. The province is already establishing a variety of basic terms in service provider contracts, and it should use its position to require common minimum mileage rates for the bidders and to ensure that all travel time is paid time. It's notable that in July of this year, the Digital Platform Workers' Rights Act will come into effect and will ensure that gig economy workers receive minimum wage for the time between work assignments. As a province, we should provide no less, and indeed we should do better for our healthcare heroes. A second deficiency in the system as it relates to home care is that these frontline healthcare workers, unlike other in the continuum of care, are not an essential service for labor relations purposes. By contrast, collective bargaining for frontline hospital and long-term care and retirement home workers is governed by the Hospital Labor Disputes Arbitration Act, something we call HILDA. HILDA enables the respective bargaining partners to refer their impasses in collective bargaining to a binding third-party process. While not perfect, HILDA both ensures labor stability and provides an objective system for establishing relative terms and conditions of employment across a spectrum of providers. As has been demonstrated by the industry advocate Home Care Ontario, wage disparity between home care workers and those working in settings covered by HILDA has gotten significantly worse since and following Bill 124. This disparity must be addressed. We recommend that with this budget legislation, the province extend the features of the Hospital Labor Disputes Arbitration Act to these healthcare workers too. By explicitly including home care under HILDA, the government signals the importance of the work and the importance of these workers. Continuity of care and certainty that services can be delivered in a consistent and timely manner within the home care system is in line with the core principles of the government's ongoing home care modernization efforts. Preventing labor disruptions in this bedrock sector should be a policy priority, but in doing so, the province creates the means for these workers to achieve incremental, systematic improvement in working conditions through empowered, responsible collective bargaining. Our third set of recommendations is for skilled trade apprentices. This government has been very committed to the looming worker shortage through its Skills Development Fund, which has been very effective. SDF has enabled CLAC to develop its own group sponsorship program, a comprehensive apprenticeship support service that benefits both employers and apprentices, especially those in small and medium-sized workplaces where the parties otherwise struggle to navigate the apprenticeship systems. Presently, and for a variety of reasons, group sponsorship programs don't fit well within the SDF grant program. But, bang for buck, group sponsorships create more apprentice employment opportunities than most other SDF investments. And more importantly, they improve apprenticeship completion rates. We recommend that with this budget, the province create a new grant funding stream specifically for group sponsorship programs, and that such funding be made available for multi-year commitments. Apprenticeship is a multi-year process, and effective support requires multi-year funding to ensure program stability and success. Our fourth recommendation is submitted on behalf of the more than 18,000 volunteer firefighters serving in 90% of Ontario's municipalities. CLAC is proud to represent nearly 1,000 of these individuals. We're the largest union for volunteers in the province. Volunteers are heroes in our communities. For an average annual honorarium of about $4,000, they dedicate themselves to hundreds of hours of training each year and are available to respond to emergencies on a 24/7 basis. In 2011, the federal government introduced a tax credit. It's since been renamed and it's been updated such that now up to $6,000 of earnings are eligible for a 15% tax credit, maxes out at $900. Across the country, provincial jurisdictions have followed suit. Nova Scotia, Nunavut, Quebec, Newfoundland and Labrador, Manitoba, BC, and most recently Saskatchewan and New Brunswick have introduced their own provincial or territorial version of these tax credits. In our view, Ontario should do the same. Such a move would support the efforts of municipalities that are struggling to recruit and retain volunteers. A tax credit of this nature would signal to these dedicated and brave women and men who mostly reside in rural and suburban Ontario the value the province places on the services.
Thank you very much. That concludes the time. We will now hear from the Niagara Health Coalition.
Can you hear me? Thank you. Good afternoon. My name is Suzanne Hutt, Sue, and I'm the chair of the Niagara Health Coalition, affiliated with the Ontario Health Coalition. We have a membership of more than 3,000 here in Niagara. The primary goal of our citizen group is to protect and improve our public health care system in Niagara and in Ontario. We work to ensure that our healthcare services, including home care, are provided based on our population needs under the principles of the Canada Health Act: universality, comprehensiveness, portability, accessibility, and public administration. We are committed to the core values of equality, democracy, social inclusion, and social justice. We are a nonpartisan public interest coalition determined to protect our public health care system from threats, underfunding, cuts, and privatizations. Present situation of health care in Ontario. We are in a state of crisis, Sam. Almost 1 in 4 residents in Ontario do not have access to have a doctor. Emergency departments are overflowing. Most hospitals are at 100% plus occupancy. More than 39,000 seniors are on a waiting list for placement in a long-term care facility. Wait times for surgeries, MRI, are extremely long. Home care is in disarray. Public health and emergency services are struggling to meet the demand. There is a serious understaffing of medical professionals, doctors, specialists, nurse practitioners, nurses, RPNs, and PSWs. All areas in Ontario face the same situation. The most dire is in Northern Ontario and small and rural communities. The presentation is going to address 3 areas: underfunding of our public hospitals. The base funding per person for healthcare in Ontario is $1,822.02, the lowest in Canada. That's a shame. This explains why we have the fewest hospital beds per person in Canada. The budget should take into account what the inflation rate, as the health expenses are affected by it. If the inflation rate is 2%, then the increase to the base Ministry of Health and Ontario Health funding rates of 0.5% means that our health systems are facing a deficit. Given that on average 85 cents of each dollar is spent on salaries and benefits, the health systems have a difficult job staying on budget. The result has been that every region has been affected by temporary or permanent closures of emergency departments, hospitals, services, and the list goes on. Year after year, the 3 health systems in Niagara have been in this position. Their base funding only covers 64 to 65% of what they really need. Health systems have had to make difficult choices, and all of them impact the residents of Niagara and their staff. Niagara Health has cut all emergency surgeries at the Welland Hospital. Fort Erie and Port Colborne no longer have 24/7 urgent care, and there is a plan on closing those 2 hospitals in 28-29. The Welland Hospital is no longer a full-service hospital. Niagara Health has cut all emergency surgeries. Hallway medicine is now the norm, as Niagara Health is more often than not working at more than 110% over capacity. In 2023, Niagara had 1,054 beds and 33,390 admissions. In 2023-24, there are now only 1,045 beds to deal with 35,648 admissions. Wait times in the emergency department are long, in many cases more than 12 hours. Ambulances are waiting hours to offload. Patients are in the hallways, waiting sometimes for days for surgeries and admissions. Directives have been sent to the staff regarding overtime, with the end result of many departments working short-staffed and long shifts. Even if the health system is hiring, it cannot fill all the position it needs. Hamilton Health has a staffing freeze. That has an impact on the West Lincoln Memorial Hospital. All monies that are allocated in the provincial MOH and OH budgets should be spent. It is appalling that in the time of our health crisis, more than $1.3 billion was not spent. Health systems have to look at additional ways to finance their operations, and parking fees is one of them. Recently, Niagara Health dramatically increased its rates, making it difficult for many to actually go to the hospital to access care. All health systems depend on so-called one-time funding from the government to help relieve the financial stress, some of it. So our recommendation is to increase the base funding to $2,270.56 per person. That's the median for Canada. Increase the MOH and OH-based funding so that hospital systems do not have to rely all the time on one-time funding. The base funding should be increased to at least a minimum of 70%, and make sure that all monies that are allocated in the budget are spent. The second problem we have is privatization of our healthcare system. The government has passed legislation that allows for the privatization of hospital services. Taxpayers' monies are being used to fund for-profit clinics, hospitals, and for-profit staffing agencies. It's estimated that more than $1 billion has been taken out of our public health system. And what has the impact been so far? Private clinics get more money than hospitals for the same procedures. Cataract surgeries, hospital gets $508, the clinic gets $1,264. Knee arthroscopy, hospital gets $1,692, and the private clinic gets, guess what, $4,037. The ministry dictates the type and number of surgeries each health system can do. Most hospitals have underused operating rooms and certainly could handle the larger number of surgeries. In Niagara Falls, there are 4 operating rooms and only 1 used in evenings and on weekends. The St. Catherine Hospital has 12 operating rooms, of which 2 are not in use. On any given day, most of the other operating rooms...
Thank you very much. That concludes the time for the presentation, and that concludes the presentations, and we will start the first round of questioning, and we will start with the official opposition, MPP Stevens.
Thank you, Chair, and I want to thank my mayor for the City of St. Catharines for taking time out of, I know, your very busy schedule, and thank you for coming, as well as the other presenters here. I know that you've taken time out, but I wanted to introduce my mayor, who is not here wearing his mayor hat, I take it. But I do have I'm going to focus in on the regional transit, though, Mayor Matt. I'm going to focus in on how important it is to have regional transit, but also, as when I was a city councillor, as well as you sat beside me, our regional transit had not existed as of yet. Our fleets were at a brink of, I guess they were just on the verge of needing repair, a lot of them, and the cost to the city budget was substantial. Now we have a regional transit. I'm wondering what the municipalities will have to be charged for the repair of our fleets throughout the region.
I can give you a little bit of historical perspective. When I was first elected to St. Catharines City Council, I was added to the St. Catharines Transit Commission. At that time, it would cost us about $400,000 to replace a conventional 40-foot diesel bus. Right now, you're looking at a purchase price upwards of $800,000 to $900,000. So it's more than over the course of the last 14 years for that purchase. Our average fleet age, unfortunately, has not really come down, and I gave you the provincial numbers.
Right.
The goal for any bus any fleet is to have an average age of about 6. Okay. Provincially, we're at about 9.5 right now, and what happens is you can start to see very clear increases in your maintenance costs. Right. So we've started to see that over the last couple of years. We've been able to take advantage of the joint procurement that Metrolinx offers, which has been good for us. But the reality is that we are still going to have to put those bus purchases onto the levy if there aren't additional funds that are made available. One of the problems which occurred during COVID specifically was transit operations across the province were stuck in a situation where there's no revenue, there's no ridership, and so buses that would have been replaced on a regular schedule then got caught behind, and all of the systems wound up in this situation where we have buses that are older than they should be, so our maintenance costs are increasing. So ultimately, it's a growing problem that is going to cost more and more money to fix.
Great, and I've been an advocate, as well as my colleague here from Niagara Falls, and I know that the region, and you're a regional councillor as well, has advocated for two-way all-day go, not stopping at the Grimsby station where the sign's there, where no station is, but going all the way to Niagara Falls. And I know that the region of Niagara has stepped up to the plate and really have committed to the station right here in St. Catharines to make sure that we have the infrastructure in place, as well as we have the GO buses to be there. And what pressures will that do to the city of St. Catharines, or could do to the city of St. Catharines for our regional transit, so for our municipal services? Will that cause an increase in the budget for municipalities, that the province might be able to bear those costs for the taxpayer? We only have one taxpayer, and I'm wondering if we can have the province maybe help out municipalities to alleviate those, as you said, maintenance costs or infrastructure costs.
As we said, when we came together with this amalgamation, we were given verbal commitments for transition costs that did not come from the provincial and federal government. If we were to move forward, if we got to a place of all-day two-way transit, or GO transit, and I will put my mayor hat on for just a moment and say, firm advocate for all-way, or both ways, twice a two-way traffic. We need as much of that as possible. There will be additional costs. The regional transit system was amalgamated. The impetus in large part was being there to service the GO stations across the route and across the system. We have contingency plans for if and when that two-way all-day GO service comes in. There will be obviously operational costs associated with that, and frankly capital costs as well, because we are already experiencing an uptick in transit ridership. This past year, 2024, was the biggest year for Niagara transit ridership ever. We grew our numbers from pre-pandemic, pre-amalgamation. All of those numbers are up. We're up 84% in ridership from when this service was amalgamated initially. So, we know that there are increased costs, and we also recognize that short of putting that burden on the property taxpayer, we will need help for those additional costs.
Okay, great. And thank you for that. And I do want to mention, I know that you mentioned about a transit plan that's coming forward, and I hope that in the future you're looking for our seniors. I was at a seniors roundtable on Monday, and they had mentioned that, they can't get to the Penn Center. A lot of times it's difficult through our municipal transit. I figured I'd pass this on, that maybe in your plan across Ontario, we can find somewhere some finances for them to ride the transit for free, to get to their shopping, to get to their doctor's appointments and paratransit, also to put some money into that as well. I'm just stating that, so if you could bring that forward, I'd greatly appreciate it. I wanted to move over to the gentleman from CLAC, and I wanted to ask you, I have several residents, senior residents, as I mentioned to the mayor, that are complaining that their PSWs are not going to be able to see them because these buildings within the municipality are charging $4 for them to park. And you had mentioned that their wages were already $6 less than what a PSW in the field makes. Now this $4 when they go to visit a resident is now added on to the burden of their daily take-home pay. Have you heard from your members that this is a burden on them?
Well, I can't speak to parking costs. That's not to say it's not true.
1 minute.
It's not one I've heard, but I do know that the cost of transportation is what they bear, that the true cost of getting from client to client is not borne by the employer. So it's, at the end of the day, out-of-pocket costs that they have to carry in a way that most workers don't in order to get around to meet the needs of the clients they're supposed to be serving.
Okay, great. Sorry that I'm cutting you off. I got one minute and 30 seconds. Sue, I'm just wondering if you can answer this maybe after the next round. What do you know about the board at the Niagara Health System? And is there any representatives on the board from actual healthcare workers, members who have experience working in healthcare themselves? Do you know any information on that? I've been trying to find it.
Actually, I looked at the board members, and there's none with healthcare experience, not whatsoever. One must say that there's a lot of accounting experience.
Thank you very much. We
Thank
now
you.
go to the MPP Hazel.
Thank you guys for coming in and presenting to us. I'm going to start off my question with Ontario Public Transit, Niagara Transit. And I hear you loud and clear, and that's a situation all through Ontario. And, you know, hats off to you for, with your organization, you know, still trying to make it work, because we have to push through. Transportation is the connectivity of Ontario. And when you said, like what really touches me is when you said if there is no intervention, and we're talking about funding, like one of the option is increasing fares, and to do that when there's an affordability crisis right now, and I know that decision is going to be difficult, you know, to make. When we invest in transit, it's supposed to be reliable, safe, fast. And so can you talk to me about these 3 points and how it relates back to your underfunded operational cost that has not kept up with the inflation?
I appreciate the question. You are 100% correct. You know, reliable, safe, and fast is exactly what we're always aiming for. And the fundamental reality is safe has to be the first priority, and we will not, you know, compromise on safety. But recognizing that of those 3 things, safety is the piece that we have to make sure we are maintaining at all costs. Reliability and speed are what start to take a hit. And, you know, I've had this conversation in St. Catharines specifically. This is a car town. You're right down the street from an old General Motors plant. Someone in this room may have worked there at one point. But getting people to recognize the value of transit over time has been difficult, but we're seeing more and more uptake now. One of the frustrations I hear from people, though, is that it takes too long. And even just to wait for a bus, you know, right now during the daytime, we're at half an hour between buses on almost all routes. But that's not frequent enough. If you miss a bus and you have to get to work on time, missing the bus means you're probably late. We want to increase the frequency of those buses. Once you're on the bus, the trip takes about as much time as it takes to drive your car or any other mode of transportation, but it's getting on the bus. And so increased funding would allow us to increase the frequency. Okay. The reliability piece goes to the maintenance piece that I was talking about before. Yeah. The older your average age of bus, the less reliable, unfortunately, your service is going to be, because buses will break down on a more frequent basis. And so that's where we see the need when we talk about the provincial gas tax and seeing that increase. I believe last year the gas tax funding was about $378 million. Okay. That's only scheduled to increase to just over $390 million by 2028-29. So, you know, we're really struggling to keep up. It's going to continue to lose purchasing power. And with the cost of those buses having more than doubled in some cases over the course of the last 15 years, you know, we're really stuck between a rock and a hard place, where our only option is to increase our operating costs by increasing the maintenance costs, which means going back to the taxpayer, or, as we had to do this past year in Niagara, raise our fares. It's not something we take lightly, because we recognize the people that are using transit. In a lot of cases, that's the affordable alternative, and making it less affordable makes it even more difficult to help people get to work, get to the recreation opportunities.
Yeah, thank you for that, and very well said. But there's another,
1 minute.
I would guess another gap that you're facing again, all of us are facing, is the population growth.
Yes.
That we were not prepared for, that hits, you know, every sector that makes this economy work. But how are you coping with that?
Well, it makes it very difficult for us to expand routes, and we do have routes in the city that are absolutely packed. And to purchase the capital stock that you need on the road, to be able to hire the drivers that you're going to need, as the population increases, those popular routes get more popular, but we don't have the capacity to be able to continue to go back to the taxpayer, to continue to go back to the rider through property taxes or through the fare box, to be able to do that. And so it becomes a very difficult situation to expand the service where the additional population is coming from, and we see it in this community and across Niagara. It becomes a very difficult proposition to be able to afford it.
Thank you very much. That concludes the time for that. We'll now go to the government. MPP Oosterhoff.
Thank you so much, and I want to thank all of you. Nice to see you all again. Sue, how are you? Happy New Year. Good to see you again, Your Worship. Always a privilege. And Ian, welcome back to St. Catharines. I have a couple of different questions. I want to start just because, and Sue, we've known each other for quite a long time, and I know we don't share all the philosophical alignment, but we do have, I think, a mutual respect. But I do have to ask something, because you said right off the hop that you're nonpartisan, and I just wanted to kind of clarify for a second. I just want to ask, where were you last Thursday evening? Where were you last Thursday evening?
Last Thursday evening, I was at a nomination meeting for Dave Augustine.
For a new Democrat
Yes.
in Niagara. Okay, just making sure. So just wanted to be clear about what nonpartisan meant from your perspective and the alignment
So
with that.
I would like to make clear
Yeah.
that the organization, our organization, is nonpartisan. And I can assure you that we have a lot of conservatives, we have a lot of liberals, Greens, social Marxists, non-political, NDPers that are part of it.
Okay, perfect. I just wanted to
Okay.
make sure I was, okay, so.
Yeah,
the
so when I
nonpartisan was
say
more-
that the coalition is
coalition
nonpartisan, it is nonpartisan,
Okay.
all right?
No, I appreciate the clarification. Just wanted to make sure
Okay.
I understood the distinction there. So you're not personally nonpartisan, but the organization.
I
as a
was
whole.
trying to actually also go to the Liberal nomination that was held on the Tuesday night, but I was unable to.
Next time.
So
next
just to
time.
let you know.
Yeah, no, it's good.
okay?
It's good context. I just wanted to clarify that. Question for you: Have you seen the recent increase? So we spoke this morning with Brock University. They increased the amount of funding for their programs for nurses in the region from 300 to 800 spots as a result of investments from the provincial government. Now, those spots are only just now beginning to generate new grads for nursing positions. You know, it took a couple of years for that to get up and running. But as those hundreds and thousands of graduates come into our healthcare workforce in the area, what kind of impact do you see those massive amounts of new graduates having on local healthcare?
So I think it will have a huge impact because there are such severe shortages for nurses, be it in the hospitals or long-term care, public health. And so certainly that will be key in making sure that we are, that we have the staff that we need. The big thing is to be able to retain them, the retention in our area. And there is so much poaching going on. I know of people who they've gone to Nova Scotia and New Brunswick because they got a bonus of $50,000, $75,000 to go, and the moving costs and the whole bit. They sell their house here, and guess what? They're able to buy a house. They have no mortgage. There's all kinds of help. The same is happening in the U.S. They're poaching our people, and so the retention piece is super important, that we're able to keep our nurses, and this is who you're talking about right now, in Niagara or in our area, in Ontario, and that means an awful lot of work, and we need to have actually more nurses graduating than 300-400, because guess what, the great tsunami is here, and people are retiring. A lot of nurses are retiring, and we need to do that. So it's a great step in the right direction, and we need to have more people being trained to be medical professionals, MRI for diagnostics and RPNs and nurse practitioners. We need more of that.
Great.
We're so far behind.
I appreciated the great step in the right direction and more work to do, because I think everyone agree there's more work to do. Your Worship, I had to ask about the gas tax funding, because I know in 2022 to 2023, Niagara Regional Transit got $1.9 million roughly through the gas tax funding. As of last year, that was $6.8, almost $6.9 million in gas tax funding. I mean, that seems like a pretty substantial increase in a couple of years there, and I'm wondering what kind of an increase you would want to see. I mean, almost tripling in 3 years. Is that what you want to see continue, or what's kind of the vision that you have for increased funding?
So it's important to note that gas tax funding, my understanding is it's based on the number of rides. In those years during COVID where transit ridership was down, obviously, it was significantly less. I know as a member of the St. Catharines Transit Commission in the past, we received upwards of, I want to say it's in the $4 million range. So that's the amalgamation now of the different transit properties coming together. as I said, we're hoping to see an increase overall in the gas tax funding in the province of Ontario up to $725 million. And it really comes down to that purchasing power, as I mentioned earlier. The reality for us here in Niagara is we try to put our dollars almost entirely towards capital infrastructure, given the nature of gas tax funding and the fact that it is based on things which can be outside of our control, global pandemic being a great example of when ridership is going to dip. We don't want to be putting our operations on that funding. We want to make sure that it's going towards our capital improvements. If we go back to, and this is going to go well back even before I was a councillor, there was an Ontario bus replacement program. It was cancelled by the last government, and that program had been used by municipalities for those capital purchases. It was ended in, I believe, 2009 or 2010. That was very helpful, but since it's leaving us, we've had to rely on this capital.
1 minute.
On this capital cost.
Can I push a little bit on that, though? I know
For
we
sure.
maybe have to be careful with how much is public, but I know for a fact that there's been investing in Canada Infrastructure Program investments as well coming into the Niagara Regional Transit for bus replacements.
Definitely, ISIP has
Yeah.
definitely been a part of it, and we've tried to leverage those dollars for a lot of our capital infrastructure programs. And this is where I will get to the nub for us here in Niagara. I mean, a lot of the infrastructure that was brought together and amalgamated under the Niagara Transit banner was aged and had needed a lot of work, and in some places just outright replacement.
Right.
We're undertaking that work now. But it comes at a cost. And those capital pieces, I mean, we're not the only transit system. Investments in transit were significant throughout much of the 70s and the 80s. It started to die off a little bit from upper levels of government, and we've been left with the property tax base to fund it, and that's a very difficult place to be.
Thank you. I would note for every... Oh, sorry.
We'll have to continue that in the next round. MPP Gates.
Thank you very much, and I'll thank the Ian and Matt for being here. I'm not sure how much I'm going to get to you guys, but I think as I talk about this, you'll understand that, particularly as being a mayor of a city. There is nothing more important than attacking the crisis that we have in healthcare today, not only in Niagara, but right across the province of Ontario. And you have to ask yourself, how did we get here? It was a self-inflicted wound, quite frankly, because this government decided to bring in Bill 124. That attacked workers, attacked healthcare workers, and most of those women were workers. And then after they did that and they passed that, and every one of them passed Bill 124, they then knew it was unconstitutional, but they continued to fight it in the courts, fight it in the courts, fight it in the courts, as our healthcare workers got more and more frustrated because they're going through COVID. They were working harder, working double shifts, because the one thing I know about healthcare workers, they care about that patient. And a lot of times, they care about that patient sometimes more than their own family does. I know that for a fact. Then they brought in Bill 60, and this is the one that you talked about on the privatization of healthcare. That's where they want to go. They want to go to privatization. We saw that with the $1.4 billion that they're spending on agency nurses. Now, there is a role for agency nurses in the north, because sometimes you can't get those workers, but not to the extent that they used them in long-term care and home care and all the other stuff that we did. So that's where we are. So then what happens in Niagara, because I'll get back to Niagara, because this affected everybody across the province. But in Niagara, what they did is, people aren't talking about it. When they brought in this system where we're going to have built the St. Catharines Hospital, they closed the St. Catharines Hospital. They closed the Hotel Dieu. They closed Niagara in the Lake. They closed the Fort Erie Hospital. They took services out of Niagara Falls. They closed the Port Colborne Hospital. They took services out of Welland. And every single time, it affected the health care that we're getting in Niagara. In my community that I represent, and I'll talk about what I represent, in Fort Erie, Port Colborne's going through the same thing, but they've done something else that I'm sure the MPP from Port Colborne is going to address Welland and Port Colborne. In Fort Erie, we have 40% of the people of the 40,000 that live there are seniors. They have to drive down a highway in the middle of the winter that they know that they close that road quite regularly because of the snow and the conditions, the weather conditions. They were running 24/7 urgent care center in Fort Erie, and what happened is they decided to cut it to 10 hours in the urgent care center. Now what happens then is all those seniors and all those people in Fort Erie, the 40,000 of them, they now have to either go to St. Catharines or go to the emergency in Niagara Falls. What we know about those two facilities, their emergency rooms are full. You're waiting in St. Catharines, it was mentioned, 15 hours. I know people are living are getting hallway medicine today where they're sitting on a cot for 5 days. And what did the Attorney General say about fixing our healthcare system and alleviating the problem out of emergency care facilities? You have to have an urgent care center, invest in urgent care centers so they'll go to the urgent care center, because a lot of them don't have doctors, because we're short 106 doctors in this region. And that would alleviate some of the problems in our emergency rooms that we're seeing in Niagara Falls and St. Catharines. And think about it, 15 million tourists come to Niagara Falls in the summer. Imagine that, as well as the 40,000 are coming from Fort Erie, Ridgeway, Stevensville, Crystal Beach area. So we have the crisis in healthcare. And Sue, everybody has the right to join a political party, whatever you want. You can go and see. But the coalition itself is nonpartisan. That is accurate. But I want to say to you, you have taken on this issue. You're a teacher. I thank you for your role that you played as a teacher. You're a wonderful teacher. Your students loved you. But in your retirement years, you've taken on health care. And you've taken it on because Niagara is in such dire straits when it comes to health care. I want to say to you, keep fighting health care. There is nothing more important, because if you don't have your health, you don't have anything. You can have all the money in the world. It doesn't matter if you don't have your health. And if you don't have that nurse there or that doctor there taking care of you, if you can't get the surgery when you need it, that's what's happening in the province of Ontario. It's happening right here in my community. No question there. I know there's no question, but I had to say this because it bothers me so much that I see people. I get calls almost every time. I'm sure Sam's getting them and Jenny's getting them in their offices of what's going on in our healthcare system and the lack of care, the lack of nurses, the lack of doctors that's going on. So I got my healthcare stuff out, Sue. I just want to say thank you. I want to say to Ian from CLAC, the gig worker is doing the same thing as your members. The difference is the gig worker, through the bill that they brought in, that gig worker, if he doesn't get a job for 2 hours, he gets paid zero for 2 hours. In Ontario, one of the richest provinces in this country, where they get paid no money to perform a job. So I go to work at 7, I don't get a job till 9 o'clock to deliver breakfast or whatever. For those 2 hours, get no money, zero. That was brought in by the law of these guys. And to Matt, I'm going to ask you a question quick. I don't know how much time I got left. I'll take another 10 or 15
minutes.
if you want.
2 minutes.
Matt, I'm going to ask you this question. They've talked about Vegas North. So my question to you, has the tourist minister met with all the mayors of Niagara so that we can have a discussion around what we're going to do at the airport, what we're going to do at the Shaw, what we're going to do in Niagara Falls, going to be casinos, what we're going to do at the Welland Canal, what we're going to do down in Port Colborne? Has there been any meetings with all the mayors? Because I believe St. Catharines pays some of the freight for the Niagara District Airport along with Niagara Falls. I believe you do. Has there been any meetings on that? Because Vegas North, just the word Vegas North kind of scares me. I don't want to have anything. I don't want to have the social problems that we have in Vegas and some of the stuff that happens in Vegas. We have one of the prettiest areas in the world, whether it's Niagara Lake, you got the Welland Canal, we got the falls. What do we want to do with that, and have you had any meetings? I think it's important for people to know how far down the road this is, or is this just another pipe dream that we're going to build under the 401?
So I can't speak for the other mayors in the region. I know I've spoken to the minister. For the record, St. Catharines pays half the freight at Niagara District Airport. But we have had conversations. I've had the conversation with the minister, but I can't speak to the conversations he may or may not have had with other mayors in the area. I believe Mayor Diodati has had conversations as well, but I can't speak beyond that.
Okay, I appreciate that. Sue, I'm just going to finish up by saying, do all you can to get that 24/7 for the residents of Fort Erie. We need that. They got a good group down there that's working extremely hard. And I'm saying to my colleagues over here, you guys play a role. Some of you guys are ministers. Sam's a minister. You can make sure that we have 24/7 for 40,000 residents. I know that Grimsby's got their hospital, I think, is up and running. They have some facilities there. We need the same thing in Fort Erie. We need to make sure that our seniors, when they need health care,
Thank you
they have
very
a place
much.
to
We'll
go.
now go to MPP Hazel.
So my round of question is going to be for Sue. Sue, I admire you. I admire your passion. I admire your energy, and this is basically your second job. It's a job. This is full time. It is full time. Let's call it that. And you've got your organization is servicing over 3,000 members, and I think that is great. And so I was looking through your presentation, and I was following it along while you're presenting. You mentioned that 39,000 of people are on a wait list for surgeries, right? And I just want to add that over 11,000 people died waiting for surgery. So this is an urgent situation. There is 2.5 million Ontarians without a family doctor. We know there is shortages of doctors. We know there's been closing of emergencies, rooms left and right, sent all over Ontario, especially in the north. You also talk about privatization versus public health care. But what I want you to do is you talk about your 3 asks to the committee. Can you put that? Can you wrap that up again? Because there is so much information shared here today. I want to make sure you have that on record of wrapping up your presentation.
Okay, so in terms of underfunding our public hospitals, what we're asking as a minimum is that the base funding for hospitals is increased, so it'd be base funding per person to $2,270.56. So if we have 18 million people, then that means 18 million times $2,270.56. The second thing that we're asking is that the base funding from the Ministry of Health and the Ontario Health, that it's increased so that hospital systems don't have to always rely on one-time funding. They don't know if they're going to get it or not. So, for example, Niagara Health, they had a huge deficit last year, and all of it, they got some one-time funding, and one of them was $13 million that they managed to dig out that it was owing to them from before 2013, right? So they shouldn't have to do that. And that all the monies that are in the budget are actually spent. None of it, like we all set budgets, they're a guide. That means that we have the money to spend it, so then spend it. It should be going into our health care and not staying in the treasury, okay, not being a surplus. For the privatization of our public health care, well, first of all, we don't believe in it. We don't support it. It's against the Canada Health Act. The government is receiving funds from the federal transfers for health care, and they believe in the Canada Health Act, so then they should actually follow the mandate. The other thing that we're recommending is we have so much unused capacity in all our hospitals, and I gave an example just for Niagara, that there is no need to have private clinics doing hospital surgeries. Just the ministry determines how many surgeries, each type of surgery that the hospitals are going to be doing. So why not just increase it? They have the room, they have the staff, they have the infrastructure. Do it. It's a heck of a lot more cost effective. The third thing I didn't get a chance to speak about was our medical personnel shortages, and Sam did bring it up in terms of the nurses. And this whole thing about the lack of doctors is huge, because you have one community after another putting
Thank you very much.
Carrots.
That concludes the time for that question. We'll now go to MPP Barnes.
Thank you, Chair. I just wanted to address with Sue that thank you for your advocacy. I just wanted to ask if you were aware of the 4% base increase that happened to hospitals just before Christmas. So there was a 4% base increase for hospitals just before Christmas.
Oh, sorry, can you speak up, please? I have a hearing impairment.
I was saying, is that better?
Yeah,
that if you're aware of the 4% base increase for hospitals that happened just before Christmas, just before we went on break, are you included in that?
No,
You're aware
I'm
of that?
not including that.
Yeah.
All right.
So that is something that has happened an average of 4% for the last 2 years in a row. And also the investment of building interprofessional teams that was also announced. That I think there was 2 teams that were formed for $2 million that would be servicing Port Coburg, Ridgeway, Fort Erie, and Waynfleet, I think it is, Waynfleet. Those are, so there's still continual investments in healthcare that we're continuing to do, and supporting hospitals as well, working with them when they have deficits and looking at what those are and addressing those on a case-by-case basis. So I just wanted to, wasn't sure because Christmas is busy, so I just wanted to make sure that you were aware of that 4% base increase, so you can have that in your numbers as well.
Thank you.
Okay.
I am aware that announcements were made. However, there still is not a family health team in Port Colborne because the group that applied to see if they could be a family health team, they still have not received any information. So it's great to announce things, but it takes time for it to get implemented. And so in the meantime, people are waiting, and you have the lack of physicians, and that is a real difficult situation when you're missing 13 physicians or 15 physicians in a community like Port Colborne. And in Beamsville, they do have a clinic, and they're going to have to close unless they get a couple of doctors. And the doctors are going to Port Colborne and for Welland and Niagara Falls and St. Catharines rather than Beamsville because they're being offered more money. And especially Welland and Port Colborne.
And I understand, sorry, Mayor, I do want to get to Ian as well. In regards to doctors, we've done a lot of investments in getting doctors, in moving to get international trained doctors to be certified. We've been working very closely with the Physician Association. So if you want to help us in advocating in those places as well, that would be fantastic additions to that, as well as around getting students into family residency. So we're now funding education for doctors. We have added 3 medical schools. We have added a medical school that is only for training family doctors, which is York, and we have also expanded residencies. So continue advocacy, but I would also advocate with some of those bottleneck areas that cause us to be difficult getting doctors into the system. So you're doing a great job in regards to being a voice and to advocating, but I'd also to focus on some of those pieces that are bottlenecks around those as well. So we'll thank you for your help on that one.
Okay, thank you. And we really want to encourage our residents in Ontario to we encourage them to become doctors and health professionals and be able to retain them. We know that here, just in Niagara, we need over 106 physicians. So you need to graduate a lot of doctors in order to meet the dire need that we have here in Ontario. Right?
Yeah,
so everything that's being done is a big help.
Yes.
Unfortunately, we want more.
I know, and we're playing catch up, right? Because we came back from a system where we got seats were cut and there wasn't any medical schools built for a while. So we're a little behind the 8 ball working through that. So thank you again, and my question is for Ian. Awesome the job that you do. We've had great opportunities to work together in regards to the SDF and you really getting more of your youth and stuff into trades and special training. I just wanted I didn't really hear a lot of the information that you had around the volunteer firefighter credit that you were talking about. Could you expand on that a little bit more?
Yeah, thank you very much, MPP Barnes. As I mentioned, the province is served by 19,000 volunteers. 90% of our municipalities rely on them. Recruitment in that space has been a challenge, and They are as frontline first responders who are giving of their time. Most of them have full-time jobs. They run businesses. They've got farms. Incredibly dedicated, hardworking people. The federal government has seen fit to provide a tax credit that now amounts to 15% on up to $6,000 of their earnings, capped at $900. And as I mentioned, most jurisdictions have tried to replicate that. Without boring you with too much detail, there used to be a tax exemption for volunteer firefighters on up to $1,000 of earnings. When the federal government introduced a credit, it meant that the exemption was no longer in play, which meant that that $1,000 became taxable by the provinces, which is what prompted the provinces mostly to say, we don't want to take in more than we used to receive from volunteers by virtue of the federal tax credit. So the introduction of the tax credit across the country, again, most jurisdictions, recognizes that the introduction of the federal credit is something to replicate because of the signal it sends and because it doesn't make sense for the province to take in revenue from volunteer firefighters that it didn't previously receive, if that makes sense.
Thank you, Nat. The other piece that was interesting was the standardized minimum gas rates. Like, what, from a governmental level, what would that look like? Like, what are you thinking that would look like from the governmental side?
The province controls the service provider contracts and includes in there a variety of terms that bidders must achieve or must meet as part of their tender. And so our suggestion is that we introduce some basic terms for frontline workers that the bidders have to incorporate into their tenders so that there's common experience across the province for travel and wage reimbursement, travel time and wage reimbursement. The province sits in a unique position to be able to drive that because they're setting the
Thank you very
conditions.
much. That concludes the time for that question. It also concludes the time for this panel. So thank you very much, everyone, for preparing so ably your presentation and presenting it that way, and we very much appreciate that, and I'm sure it will be a great benefit to the committee.